Hello. Okay. Okay, fine. Okay. Okay. Hello, students. Okay. Uh, Hope you're doing fine. We'll see some questions. This PSM recall NEET PG 2023. So as you see that, hope I'm audible. Okay, you can put it in the chat box. Hope I'm audible. Yes. Am I audible? Yes. So let us see the overall pattern. Okay, let us see the overall pattern. What has happened in this NEET PG 2023. First is there is okay, fine. So first, there is no questions from biostatistics and screening. That means I'm just giving, these are recall sessions. So based on what we learned from other students, the questions, and there is no questions from biostatistics, as these are the past 2 years. This is the third year. We don't have any questions from biostatistics. Okay, fine. And we don't have any question from screening. So, and we have only one question from epidemiology. So what does it mean? It means that the concept based questions are not there. Okay, so out of 200 questions we had roughly around 21 questions, which is somewhat overlapping with other subjects, mostly integrated with other subject. It can be part of any basic science subject, as well as some medicine clinical subject is also there. And we have nutrition if you take. Okay, good evening guys. Okay, so we had 5 questions from nutrition, 5, and 5 questions from communicable disease. Okay, infections, we have some communicable disease, we have some 5 questions. And the one more point here is that almost all questions what I'm going to show here, okay, almost all questions came from textbook of Park. Okay, so nothing came out of it. So you are asking that anemia question. Okay, you are asking at the anemia question. Anemia question, okay, it's more related with OG and PSM. Okay, fine. Now, so it's better that question can be answered by OG also. From program point of view, I will tell you what we can do. Okay, fine. So is this fine? Am I audible? So then we can go with this. First, let us start with the first question. Okay. So there is a varicella outbreak in hostel, and what we should do, cases and contacts have to be done. Okay, so everyone gives a different version, but the concept, let us see the concept. Okay, so what we will do, there is a varicella, that is chicken pox. So in a hostel, for cases what we are going to do, for contacts what we are going to do. Okay, fine. Now, so for that we should understand, is it not UG, NEET EUG? It's more for NEET PG, NEET PG, not for UG. Okay, WABI is for NEET PG. Fine. So we have to understand certain terminology here for this question. Okay, for isolation, first isolation we do for cases, isolation we do for cases, and quarantine we do for controls. Sorry, contacts. For quarantine we do for contacts. For cases we do isolation. Okay, so you have to understand, it's a straightforward question actually. The isolation is done during the period of communicability. POC I'm writing, period of communicability. So the period of communicability for smallpox, sorry, chicken pox, it is 1 to 2 days before. Okay, and 4 to 5 days after. Okay, 4 to 5 days after. Quarantine, the incubation period here is 14 to 16 days. Okay, for chicken pox the incubation period is 14 to 16 days. Okay, fine. Now So the question here, it starts with, okay, what will you do for the cases, and what will you do for the control contacts? That was the question. Okay, fine. Now look here, isolate cases for 14 days. Okay, and what we should do here, isolate cases for 14 days. So there is no point in isolating cases for 14 days. Okay, so isolation should be done for period of communicability, and immunoglobulin contact should be within 48 hours. Okay, so that is also wrong. Okay, so what we will do is that I will, okay, you want me to short video? Okay, we'll have some 40-45 minutes. We'll finish it. Okay, fine. So this is the direct picture from the textbook of Park, and it says that, okay, it says that the control for cases, for we have to do isolation for 7 days, 6 days, and we have to give varicella. Okay, within 72 hours we have to give varicella, we have to give within 72 hours. Okay, so for whom we have to give this for susceptible people. Okay, we have to give it for susceptible people. Okay, fine, susceptible. Now tell me, what is the best possible answer here? Okay, you have to administer acyclovir, all those things are fine. And what is the best possible answer? Okay, for me the best possible answer is B actually. Okay, B. We'll make it in a short video, we'll make it. Okay, 40-45 minutes we'll make it, fine. So the best possible answer is B. Okay, so isolate cases, I don't know whether what is given. So what student said is 7 days. Okay, that is more related. And 72 hours, within 72 hours we have to give. Okay, that is fine. Administer acyclovir to all patients. Okay, this is wrong, this is also wrong. Okay, so we have to give immunoglobulins only for the susceptible people. Okay, fine. We'll go to the next question. Every exam there will be some amount of statistic question will be there. Okay, this is one such question. Okay, one such question. Okay, so we expect some 90% of question to be good, easy for us. Maybe 10%, 5 to 10% in any subject we'll have statistic question. This is one such question. Nobody knows. Okay, it's there in the textbook, but still it's very difficult to answer. Okay, fine. This Colombo plan, what does it be done? Okay, look here, the Colombo plan. This is a meeting. Okay, this is a meeting happened with Commonwealth countries. Okay, Commonwealth countries, foreign ministers in 1950. It's image from the textbook of Park. Okay, fine. So basically, apart from this developing countries, some other countries also were part of it. Okay, US, UK, New Zealand. So according to this, based on this, they established, AIMS was established from financial assistance with New Zealand. So we established AIMS. Okay, so financial assistance with New Zealand. Second, and what else here is the contribution of Canada in supplying cobalt therapy units. Okay, so this was also done under the aid of Colombo plan. Okay, fine. These are the 2 points, guys. These are the 2 points. So they try to improve the living standards of people by giving some assistance to the poorly developed countries. So it's way long back, 1950. Now we will see. Okay, fine. Which of the following is true regarding Colombo plan? Okay, so this cancer control, okay, blindness control program is SIDA. Okay, SIDA, blindness control program, we had SIDA. For TB program, which agency contributed is DANIDA for TB program. Okay, a few years back it was asked in this FMGE exam. The best possible answer here is cobalt plant treatment. Okay, cobalt plant treatment, best possible answer. Fine. Am I clear? Best possible answer is cobalt. Fine. We'll go to the next one, guys. We'll go to the next one. A female patient came to OPD with the complaints of vaginal discharge. Okay, vaginal discharge. Okay, and cervical discharge. Husband is a truck driver. What is the treatment kit under syndromic surveillance? Syndromic surveillance. Okay, fine. Okay, a female patient. Okay, listen, the examiners, we have 2 set of examiners. For this one we have set of examiner from NBE. So other one we have this AIMS people. Okay, so this questions may not be relevant for INICET. Okay, but more may be related for the upcoming NEET or next exam, possibly next exam. Okay, in the future. Okay, fine. So the female patient came to OPD with the complaints of cervical discharge. Okay, so vaginal discharge. Okay, so this is under syndromic approach. Under syndromic approach, so what we have to give? Okay, syndromic approach, vaginal discharge, cervical erosion. Okay, so it comes under vaginitis. It comes under vaginitis. For vaginitis, it is green color. Gray color used for urethral discharge. It's a repeated question. We had this sprint session also we had. Okay, around last month we had. Okay, so I covered around some 5 hours. Nearly 50%, nearly 10 questions came from what we discussed actually. These are common questions and you should not make mistake on these questions. Yellow is related with lower abdominal pain. Okay, lower abdominal pain. And red is related with GUD, genital ulcer disease, painful GUD. Okay, no subject is boring, man. Every subject is interesting. Okay, so you have if you are practicing, then you will know. Okay, PSM is not boring. Finally, you are going to do PSM if you are practicing in the community. Fine. Sorry. Next question. A poor farmer with successive crop failure develops progressive neurological paralysis with gait instability condition. What is most likely due to what? Okay, fine. Look here. So what is the clue for this question? What is the clue? The clue for this question is successive crop failure, poor farmer, progressive neurological paralysis. Okay, so it looks like more of a nutritional problem. Okay, nutritional problem. Okay, so crop failure. Okay, so if you see here, this aflatoxin causes aflatoxicosis. Sanguinarine is related with the adulterated food, so it leads to epidemic dropsy. Okay, fluorosis is first dental problems will come. Okay, initially dental problems and finally it may go for crippling fluorosis. It may go. Okay, fine, crippling fluorosis. Okay, first dental problem, but nothing of mention of dental problem. This is more likely to be, okay, letharism, neuroletharism. So this is neuroletharism. This is because of this BOA, beta oxalyl aminoalanine. It has this 5 stages. 2 questions from this. Okay, second question we'll see later on. So 5 stages it will be there. Okay, people consuming diet, more than 30% of diet over a period of 2 months. Okay, over a period of 2 months. The BOA means beta oxalyl aminoalanine. Okay, so more than 30% of diet over a period of 2 months, it can go for this. Okay, this is letharism. It has 5 stages will be there. Latent stage, no stick stage, 1 stick, 2 stick, and finally they can go for crippling. Okay, so this is more likely to be in people where means central India, cases reported central India. Okay, and people eat this, poor people eat this dal. What is the dal? The dal is kesari dal. It's a repeated question, guys. Okay, we should not make mistakes in this question. Fine. Next question. Correct way to collect tap water sample is probably this is for bacteriological examination. Okay, so this is, I will show the direct picture from textbook of Park. This is related with we have this 27th edition of Park. 26th is okay for your exam. Okay, but look here, this is what is given, the picture from Park. So if you want to collect any tap water for bacteriology examination, what you have to do is that you have to open the tap fully. Okay, and let the water flow for 2 minutes. Okay, so whatever stagnant water is already there, okay, you can let it flow for 2 minutes, And if the water is not used, if the tap is not being used, the tap has to be sterilized with a blow lamp, okay, or a cotton fiber, cotton soaked with methylated spirit. Okay, you just blow the lamp and using the heat the tap. This is one option. And whenever you are collecting it, okay, so whatever container you are using, okay, let it avoid touching the tap surface. Okay, let it avoid. Okay, so avoid this splashing. All these points were there, all these points. Now we'll go back to the question. Okay, so what is the answer here? Collect water from leaky taps. Probably by just like that we can say no. Collect the water with completely touching tap to prevent splashing. Okay, so you can't touch it because the tap may have some form of bacteriological contamination may be there. Take the water from gentle stream including splash water. Okay, the splash water should not be there. This is also wrong. Collect the water from running tap after 2 minutes of water to flow. Okay, probably I don't know how much time they have given in the question. Let us assume probably it is 2 minutes. Okay, 1 minute or 2 minutes they are given. Probably let us assume it's the answer. Okay, fine. This question overlaps with microbiology, guys. Microbiology. Okay, fine. Again, this question is repeated from the sprint series. Okay, so nearly 10 questions. Okay, you check the video. The 5-hour video, 2 days video. So we had 10 questions from that. Okay, fine. The 6-year-old child presented with fever, rash, coryza, presence of Koplik spots. What is your probable diagnosis? It's a straightforward question. Okay, Koplik spot is what? Is pathognomonic of measles. Okay, it's a straightforward question. Koplik spots, pathognomonic of measles. Only point is that when it will appear. Okay, when it will appear 1 to 2 days before rash. Before rash. I'm not covering the subject, guys. Subject we will learn. Okay, I'll keep it very simple so that it should be useful. Okay, 1 to 2 days before rash. After the, what type of rash you will get? You will get maculopapular rash. Okay, behind the ear, retroauricular, it will start. Retroauricular. Okay, it's a repeated question. Last few years, I think 2021, we had this question probably. And again, we had this Koplik spots, pathognomonic feature. This is asked. Okay, fine. Next. Again, this is a repeated question we have discussed in our videos also. A 10-year-old child, okay, so OPD for vaccination as per national immunization schedule. Look here, BCG is given at birth. Maximum it can be given for 1 year. Maximum 1 year. Pentavalent we give it at 6, 10, 14. Again maximum for 1 year. DPT we given at 16 to 24 months. Okay, again at 5 to 6 years. And maximum for 7 years. So what is the vaccine? Now we can give it. Okay, the baby child is what? Child is 10 years old. So 10 years old, 10 years, 16 years in the national immunization schedule. So 16 years, 10 years, 16 years and pregnancy. Okay, so we are going to give TD. 0.5 ml IM we are going to provide. Probably we will provide, okay, mostly delta we will give. 0.5 ml IM we will give. Okay, fine. So tetanus we had 2 questions. This is the first question. Okay, fine. This is also a repeated question. Okay, fine. Next PG that we will launch. Okay, video is already ready, doctors. Okay, it is going to launch. Course live batch, we are having one live batch. Okay, so we will launch at the earliest. Okay, probably in the end of this month we will be doing it. Okay, it's a tricky question, guys. Again, this is a tricky question. A pregnant female with blood pressure of 120/80. It's a headache, no visual changes. These are nothing relevant. The patient does not eat papaya and other fruits since they can cause abortion. Okay, that means they are having their own ideas. Okay, own ideas. Okay, this is very common. Okay, pregnant women, they don't take, okay, papaya. It's very common, all parts of India. Okay, so which health worker will be assigned for regular home visit for pregnant, probably for nutritional education. Okay, nutritional education. The question is related with nutritional education. Okay, so who can provide nutritional education? That is the question. Nutritional education. Okay, so if you take, if you, the only trick here is that home visits. Okay, if we start home visits, we will be thinking about Asha. Okay, Asha. Okay, but if you take the textbook, if you see the textbook, these are the direct statement from the textbook. I'm not getting anything from other sources, only from Park. Okay, so nutrition and health education, okay, these are imparted by, for nursing and expectant mothers, okay, by organized courses during home visits by Anganwadi workers. Okay, this is Anganwadi workers during home visits. Usually we learn that, okay, Anganwadi workers don't go home, okay, but for nutrition education it can be provided. Nutrition education, okay, fine. So Asha is more related with what? Asha is more related with, yes, okay, for preparing for delivery, for institutional delivery, for other things. Okay, so anyway, this they will bring the mothers, okay, to village health nutrition day, but this work is very specifically for Anganwadi workers, guys. Fine. So what are the other work? Okay, so ANM, okay, Asha, but better answer will be Anganwadi worker. Now, if a person comes with a clean cut wound with a history of vaccination 10 years back, okay, it's a repeat question. We discussed this question in our this one also. What is this? Sprint series also. Okay, so only two questions we discussed. Tetanus. Okay, the first one is, what is the elimination criteria for neonatal tetanus? Less than 1 case per 1000 live births in all districts of India. That is one criteria. The second one is that for anybody coming with a wound, we have to classify them into less than 6 hours clean wounds. So more than 6 hours unclean wounds. This we have discussed actually. So you are going to ask the immunization status. Okay, less than 5 years, 5 to 10 years, more than 10 years, and unimmunized. Okay, unimmunized. Okay, less than 5 years, 5 to 10 years, more than 10 years, unimmunized. Okay, fine. Now, less than 5 years, nothing is required. Whatever type of, nothing is required. 5 to 10 years, one dose. Here also one dose. More than 10 years, one dose. Plus you have to give immunoglobulins. So unimmunized means you have to give two doses plus immunoglobulins. Okay, fine. So what does the question says? What does the question says? The question says it is 10 years and it's a clean cut wound. So better, this is the answer. So we have to give single dose. Okay, fine. Single dose of ED. So am I clear? This is a straightforward question, guys. Okay, we should not make mistakes. It's a straightforward question. Fine. So it's the question is there in Park textbook also. Anyway, you should know it. Okay, fine. So white fingers in intermittently in worker using which machinery? This is due to vibration. Vibration can cause spasm, which can lead to white fingers, guys. White fingers. Okay. So this is white fingers associated with vibration. It can affect the joints, nerves. It can affect. Okay. So but this question is a straightforward question. It's there in the textbook of Park. Anyway, you will learn from other subject also. Years of life lost. Sorry, years of life lost depicts what? Years of life lost depicts. Okay, so the answer is years lost due to premature death. Okay, it's a similar question that has been asked in the last NEET exam also. Last NEET exam. So we have this DALI. Okay, so DALI includes two things. Okay, YLL, years of life lost, plus, okay, years of life, okay, lived with disability. Okay, this also we discussed in the single shot series. Okay, okay, sprint session we discussed this. This is what? This is years of life loss. Years of life loss leads with, okay, premature death. Last year question, guys. Okay, last premature death. disability free life years, that is different. Okay, life expectancy. So these are four indicators we have. One is this Sullivan index, that is disability free life expectancy. We have Hale is there, we have Daly is there, and we have this QALY is there, quality adjusted life years. So Daly includes two things: years of life lost plus years of life lived with disability. Okay, so this is Daly is disease burden. Daly indicates disease burden. Okay, years of life lost is premature death, guys. Okay, years of life lost is premature death. Okay, disability means the person may lost the life also, or maybe lived with the disability also. Okay, it includes both. Okay, fine. Suppose a person usual that video also you can see the normal life expectancy. Let us assume that it is 50 years, 65 years. Let us assume 65 years. Okay, at 50 years one person develops stroke and not able to walk. At 55 years he died. So how much years he lost and how many years he lived with disability? Yes, so he lived, okay, for 5 years. Stroke, he was not able to walk. So 5 years he lived with disability and 10 years he lost. Okay, 10 years he lost. Okay, this is years of life lost due to premature death. Okay, fine. Which vitamin is used in the prophylaxis of neuroletharism? This is a second question. Okay, so neuroletharism, okay, we discussed already. It is because of this BOA, beta oxalyl aminoalanine. Okay, so what is the treatment? Yes, we have this treatment is banning the crop. Okay, but poor people, it is grown just like that. Actually, it's grown just like that. Poor people, they eat, they don't have any other option. Second is that vitamin C prophylaxis you can give. Okay, vitamin C you can give, and removal of toxin you can do. Removal of toxin. Okay, removal of toxin you can do, and by parboiling method and steeping method. We have some methods available: parboiling and steeping. Okay, parboiling and steeping. Okay, I don't feel these questions are tough actually, because these are repeated questions. Okay, if you see in the past year questions, you should be able to answer. Okay, this concept is again asked in 2021 NEET exam. Okay, and recently also FMGE exam, this exam was asked. So usually what I see is that NEET exam, FMGE exam, overlapping will be there. Overlapping will be there. INA exam will be totally different. But this one there will be overlapping will be there. Fine. Okay, which are the following indicators used for appropriately healthcare of the community? Okay, this is which is the best indicator to know the health status? Okay, healthcare or health status. So health status is what? Okay, health status is infant mortality rate. Infant mortality rate, and perinatal mortality rate is pregnancy wastage. Okay, perinatal mortality rate is pregnancy wastage, guys, wastage. Under 5 mortality rate related with social development and well-being. Again, this is a repeated question: social development and well-being. Okay, this is a repeated question, and hopefully you didn't make the mistake. Fine. Okay, so upcoming year is also fine. Next. Okay, this is only one concept based question. I'm not very sure exactly what has been asked. Okay, fine. This is what the student said. Okay, aniline factory information was taken from documents. This is the only clue here. And they are starting with people with dye and dye exposure, group 2 without dye exposure, and they are cancer. So what is the answer for this question? What is the answer? Okay, so we know that, okay, it is exposure to outcome. Okay, exposure to outcome. Okay, fine. It's exposure to outcome. Okay, fine. That means what study? Okay, that means it is cohort study. That means it's a cohort study. Okay, exposure to outcome. Okay, but only reason why I'm looking here is the question says documents. Okay, so usually documents, if they are mentioning, I don't know what is the timeline they have given. So if the documents means they are going back in time and they are starting from collecting the exposure. Okay, that means what? Okay, so I am doing the study now in 2023. Let us assume these people went and collected document. Let us assume 5 years back or 10 years back. 2013 documents. From the documents, they divided people into exposed and non-exposed, and probably currently checking for their cancer. Okay. Okay, let me assume this is probably they asked what I asked. Okay, if they're saying documents, okay, then it becomes a retrospective cohort study. Okay, retrospective cohort study, because it starts with the exposure to outcome. Okay, outcome to exposure means it's a case control study. Okay, it starts exposure to outcome, so it's a cohort study. Since they are talking about the document, we are going back in time probably. Okay, we are starting from the exposure and non-exposed people to currently we are looking into the disease. Okay, so this is a retrospective cohort study. Fine. Okay, what is the answer for this question? Prospective cohort study is little depends what they asked actually. Okay, if they're starting from today means prospective cohort study, but I don't think any student said that way. So all they're claiming that there is a document was given and their data is taken from the document. They say data is taken from the document. It's most probably a retrospective cohort study. Yes. Next question. A patient with sputum smear negative but X-ray positive for TB. What next done for this patient? Okay, fine. Okay, what is the answer, guys? Okay, look here. This is also we discussed in the sprint session. Okay, so what we do, we have a presumptive TB case according to NTEP, National TB Elimination Program. We don't repeat, guys. Okay, look here, National TB Elimination Program. We have a presumptive TB case. So those who are having fever, okay, for more than 2 weeks, cough for more than 2 weeks, hemoptysis, okay, and significant weight loss, okay, then we have to rule out TB. So you first step, what will you do? You will do 2 sputum smears. 2 sputum smear plus you will do chest x-ray, right? 2 sputum smear, you will do chest x-ray. If one or both are positive means it is TB, guys. If one are positive, both are positive means TB. Both are negative, both the sputum are negative, but x-ray looks positive. This is what the question is. Both are negative, but x-ray looks positive. Okay, both sputum are negative, x-ray looks positive. What will you do? Okay, it's not repeat sputum. That concept has taken out. Okay, look at the image. This is the image I have taken directly from the textbook of Park. Okay, textbook of Park. So look here, if sputum smear is negative but x-ray suggestive of TB, you are going to collect sputum only, but you are going to do what? CB NAT, guys. You are going to do CB NAT. Okay, smear negative, chest x-ray positive, you collect sputum. Don't do repeat sputum smear. I don't think that concept was taken some long back, 5 years back, I think. Okay, fine. Nowadays we do this way only. Okay, 3-4 years back probably. Okay, sputum smear negative but chest x-ray positive means we are going to go for CB NAT, guys. CB NAT. The answer for this question is CB NAT. CB NAT. Okay, fine. Line, probe, assay and all we don't do. Okay, fine. It's a repeat question, guys. Okay, we discussed in our sprint session also. A child present with cataract, okay, hearing loss, PDAS. What is this? Congenital rubella syndrome. Okay, when the child has to be exposed, this will occur within when the child within or exposure within the first trimester. Okay, so up to 16 weeks. Okay, we discussed in the videos also. So 16 weeks it's fine. Okay, 16 to 20 weeks means the child may develop deafness. Okay, fine. No abnormalities. Okay, if the gestation period is more than 20 weeks, guys. Okay, no abnormalities if the gestation period is more than 20 weeks. More than 20 weeks means no abnormalities. 16 to 20 weeks means the baby may develop deafness. Fine. Again, this is a repeated question, multiple time repeated question. Examiners are very fond of this diarrhea, dementia, Last year we had Kessel's necklace. Okay, Kessel's necklace. Okay, probably. Okay, yes. This is what? Yes, this is niacin deficiency. Niacin. Okay. So riboflavin, we have this. What is this riboflavin? Angular stomatitis. Angular stomatitis. Thiamine beriberi. One more question from thiamine was also there. Okay, fine. This is niacin deficiency, 4 days. Okay. The question usually they will ask is maize eating population. Maize eating population. Maize eating population. Okay, fine. Next. Cement worker with X-ray changes, features of mesothelioma. Okay. Most likely cause, it's a direct question. If the question says mesothelioma, the question says, okay, then what is it? It is asbestosis, guys. Okay, asbestosis, because we have this ground glass appearance. Okay, ground glass appearance. Students say that mesothelioma was there. Okay, X-ray, if you take ground glass appearance, lower lobes will be affected. Lobes affected. What is the most common manifestation? Okay, most common manifestation is asbestos, the pleural plaques. Okay, pleural plaques, most common manifestation. Okay, associate cement workers. Okay, it's a direct statement book. Some may say that silicosis. Okay, I don't think in silicosis they are given the term cement workers. But if you look at the textbook of Park, cement workers, mesothelioma, asbestosis. Okay, it is there. Directly it is there. Okay, fine. A person with low blood pressure tend to have low BP in adulthood. This concept is known as what? Okay, so those who are having low BP, okay, this we call it as tracking phenomena. Okay, so if you look at a child, the child is having low BP, probably the child in adult also will have low BP. But if you see a child, okay, this is the image from the textbook of Park. So low BP tend to be low BP. So those who are having high BP will go for high BP. So what we are going to do? So those children having high blood pressure, you start the preventive measures early stage. Rule of halves is what? This is also associated with hypertension. So hypertension is a lot of asymptomatic cases will be there, and only 50% will know that they are having hypertension. Suppose 100 people are there, 50%. Okay, fine. Out of them, 50% will be on treatment. This concept is called as rule of halves. Right. Next is, what is the steps approach? Last year NEET question. Okay, this is used for NCD risk factors survey. Okay, every year we get one question, guys. Okay, this year tracking, last year steps, previous year it is Monica. Okay, so every year we get one question, and steps and Monica is little difficult, but steps and tracking is answerable. What is this dash? Dietary approaches to stop hypertension, guys. This is again a repeated question, but you can answer it. The clue here is chronic alcoholic patient. Okay, so double vision, involuntary movements, mental confusion. Okay, so it looks chronic. Some nutritional deficiency is there. Okay, so what it can cause? Okay, thiamine deficiency. Thiamine, this is Wernicke's encephalopathy. Wernicke's encephalopathy. Okay, so nutritive deficiency, Wernicke's encephalopathy. Okay, it's a chronic. One is beriberi, dry beriberi, wet beriberi may be there. Okay, so people eating polished rice. Okay, beriberi. Okay, so that's why we have to consume parboiled rice. So this thiamine, chronic alcoholic, Wernicke's encephalopathy. This is again repeated question, guys. Fine. Recommended daily allowance fulfill the needs of how much percentage of population? Maybe the question is framed a different way. Okay, so usually RDA. So RDA, so they will take mean plus 2 standard deviation for all nutrients. Okay, for all nutrients. And this should fulfill, okay, so 97.5 percentage of population. Okay, only 2.5 percentage of population requires extra nutrients. Okay, this is for RDA. All people, all nutrients, mean plus 2 standard deviation. Okay, fine. but only for this one. What is this? Energy. Okay, energy we use only mean values. Mean value, average values only we will take. No two standard deviation. No two standard deviation. So for mean we take that average, how much calorie requirement, because any extra, okay, a two standard deviation means it will definitely it will be stored as a fat. Okay, to avoid that, so we have this mean plus two standard for all nutrients. Okay, for we have the other nutrients are there. Okay, so calcium, everything, but except energy, guys, except energy. Fine. This is what it says here. Look here, RDA corresponds to most of the individual 97.5%. Okay, fine. I think one or two questions I have probably not touched. One is related with anemia. Probably you are asking anemia. Okay, for anemia 8 to 10 years. Okay, probably 7-week old pregnant female. 7-week pregnant. Okay, so what will you do? Okay, under the program. So under the program, she's anemic, we have to start treatment. Okay, if she's anemic means start treatment. Okay, so we are giving this prophylactic. Okay, anemia mukt bharat we have. Okay, anemia mukt bharat profile. This is prophylactic. Probably people are questioning the prophylactic anemia. We start at the second trimester. Okay, second trimester we start. This is second trimester. Okay, this is, don't link with this. These are prophylactic. The question was related with the treatment. Okay, probably Dr. Shonali would have discussed. Okay, OG faculty. So this is anemia mukt bharat. This is a prophylactic iron. Prophylactic iron. Okay, fine. So am I clear? Prophylactic iron. Probably one more question was there that is related with this raw egg. Okay, Rajesh Shah will have discussed in biochemistry. Okay, so so these are the various questions which are from directly from the textbook of Park. So what I would suggest, okay, based on this paper, okay, what I would suggest is that look here, the questions are simple. Okay, so I feel that 90% of questions is answerable, guys. 90% of questions, 90%. Okay, so probably one or two trick questions we have. Apart from that, we have 90% is answerable. Okay, being this is a NEET exam. Okay, so the questions are in a standard format, but not lot of concept based questions are not there. Okay, maybe integrated clinically with other subjects are there. Okay, fine. Anyway, hope you did well. Okay, hope I answered your questions. Okay, so if you have seen the previous year questions, okay, I would say that 75% of the questions you can answer it easily. Just previous year question, last 3 to 5 years. Okay, 75%. Okay, so hope you did well for your exam. Okay, we'll see in the next video. So we are going to have some other videos are there, and we have app is almost ready. Okay, it will be releasing. It's already released. Okay, all the videos will be there in soon. Okay, so hope you learn better from the app. Okay, fine. Thank you. See you soon.